When we look at our mobilization techniques, we can perform tractioning techniques as well as gliding. And traction is going to be great for pain relief. We can pre-position the joint. Gliding is going to be more for gaining motion. So traction is great for those activated arthroses I talked about with those older patients that have distal radius fractures. We're gliding now dorsal or volar. Now we're going to really help improve our motion because our goal is to stretch the capsule. So our glides can be performed open chain or closed chain. So I can perform, if this is improving my MP motion for flexion, I can do this open chain here, or I can fix this and I can glide my metacarpal head in a dorsal direction. And the same thing then, looking at if I'm trying to improve extension, I can glide open chain in a dorsal direction or closed chain. I can glide in a volar direction. So we're going to use that to help us work with gravity. So I've got to keep in mind that when I'm performing my mobilizations, if I'm doing traction, I'm going always perpendicular to my concavity. If I'm doing gliding, I'm moving parallel. And as long as I remember that, all is going to be good. It's important to keep in mind that passive motion can sometimes be more irritating to the joint than gliding, because with passive motion you can get the tilt effect where you can actually impinge. So when you're gliding, you're going to help prevent that by restoring the normal arthrokinematic motion. So principles of joint mobilization, we're always going to test the uninvolved side first to look at the patient's normal excursion and end feel. So we're going to be testing in tractioning and in testing in glides. And with glides, we can pre-position in their available range to perform our glides as well. So we're going to add more tension to the capsule to make our glide and our improvement in our motion be faster by pre-positioning.